The old saying goes, you are what you eat, and a lot of people take that to heart, following a healthy diet and exercising too. But scientists have found that the importance of diet starts a lot sooner than we think, with the lives our parents and grandparents led when their reproductive cells, the cells that made us, were formed.
What happens is that when reproductive cells are forming, and that would be in the situation of young boys at puberty because that's when their sperm cells are forming. With women, their eggs are forming while they are still a fetus. So it's while they are in the womb. So environmental impacts, if you think about the mother being pregnant, what happens to her during pregnancy, the food that she eats, the air that she breathes, whether she's exposed to toxins, really influences, has an impact on the quality of the eggs that are forming in a female fetus.
That's Judith Finlayson, author of You Are What Your Grandparents Ate: What You Need to Know About Nutrition, Experience, Epigenetics, and the Origins of Chronic Disease.
Those impacts register on the body as something known as epigenetic modifications. Really, the easiest way to understand it is that it's a kind of biological memory that's etched on reproductive cells. A similar thing happens to boys' sperm cells while they're forming. Another way is through a female's experience while she is pregnant.
Finlayson says some of the earliest studies on epigenetics came from wartime records, when inconceivably harsh conditions were imposed on entire nations. One was called the Dutch Hunger Winter of 1944.
That was a period in the Second World War when the Germans closed off northern Holland, and the people, including all the women who were pregnant, were starved. And the Dutch kept very detailed records of what went on with the pregnancy of women, and they tracked people throughout their health system. So they were able to really document that babies whose mothers were pregnant during this period were twice as likely to suffer from heart disease and more likely to suffer from type 2 diabetes and to be obese.
It's easy to imagine that starvation during pregnancy could lead to babies who grow up with health issues. But are grandparents really connected too? Finlayson says Swedish scientist Lars Bergen was first to discover that the answer is yes.
When boys ate too much around the time of puberty, their grandsons were predisposed to dying young, significantly younger than normal. And he then went back later and looked at women, and he found that with women, the granddaughters of women who did not have enough to eat, who were malnourished during pregnancy, were far more likely to die young.
This kind of knowledge has relevance on all kinds of levels. The United States, for example, has whole segments of society that are living rough lives with poverty, extreme stress, and poor nutrition that could doom the next generations to a vicious cycle of poor health.
Groups that have been socially and economically disadvantaged for generations, what you're going to see is that these hardscrabble lives takes its toll on women's bodies and their ability to bear healthy children. So you are very likely to see, if you look at these populations, that they have higher rates of infant mortality, higher rates of maternal mortality, and higher rates of a phenomenon known as low birth weight babies. Dr. David Barker was the epidemiologist to link low birth weight babies, or a baby born with low birth weight, and the likelihood that that baby was at a much greater risk for chronic diseases like hypertension, obesity, type 2 diabetes, and heart disease. So this is the long cycle of poverty and the links with chronic disease.
However, those on the more affluent end of American life aren't off the hook either.
what we're seeing is the long-term effects of a phenomenon that's described as high-calorie malnutrition. We know that many people in the U.S. suffer from high-quality malnutrition because they eat too much overly processed foods. And processed foods are a key component of what's known as the standard American diet. These foods are high in calories and low in nutrients. 3 generations of Americans have been raised on the standard American diet, which really started, its seeds were sown in the 1950s, and its multi-generational effects are becoming clear. We're seeing the long-term effects of those eating patterns and runaway rates of chronic illness. People talk now about obesity, type 2 diabetes, and heart disease using the word epidemic.
However, the legacy of your parents and grandparents isn't set in stone. They may push you in the direction of either good or bad health, but how you live your own life still has a big effect.
The sedentary lifestyle is much more prone to developing disease than the one who has the active lifestyle. Things like exercise, like good nutrition, and also stress management programs like mindfulness meditation, yoga, tai chi, have been shown to positively affect gene expression in ways that can help to balance some of this negative programming. So you're more vulnerable because of what's happened, but you can also take steps to remedy your inheritance through a healthy lifestyle.
That means making the most of the hand we're dealt, with a hope we can make it a little better for those who come after us. You Are What Your Grandparents Ate is available now wherever books are sold. You can find more information about Judith Finlayson and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. This segment originally aired June 2020 and was written and produced by Reed Pence. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Genetic counselors are there to help sort of bridge the gap, just to come alongside families and help them feel like they're not alone in navigating this diagnosis.
How genetic counseling can prepare you for unexpected health risks.
Then a look into medical malpractice investigations.
I don't think that the system is as effective as it should be. I'm privy to information that would shock people about what physicians are allowed to do and that they're not called on it.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
There were many days where I felt overwhelmed. I remember I would cry about how hard life felt back then.
The financial benefits of investing in yourself long-term. Then,
there's so much to do before a dead body is buried or burned, but we don't see it.
A look at one growing trend, green burials. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.